It is the season of cough, cold, fever. When cough, cold, fever occurs in pregnancy, what to do, what not to do? Should I take this medicine? Can I take paracetamol? Should I take azithromycin? Which cough syrup to be taken? Which cough syrup not to be taken? What should I avoid? We'll discuss all these things in today's video. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Cough and cold is very common in pregnancy. Almost every female suffers at least 1 to 4 episodes of cough and cold in pregnancy. It might or may not be accompanied by fever. It may or may not be accompanied by sore throat. But cough, cold, fever, sore throat, they are very common in pregnancy. Why cough and cold is common in pregnancy? Because pregnancy is an immunocompromised condition. Because the fetus or the embryo contains the foreign or the paternal antigens in form of sperm, it is a foreign body to the female, and to accept the pregnancy, the immunity of female becomes down, and as a result, in pregnancy, most of the females suffer various infection, and cough and cold is a very common infection. That is the reason why urinary tract infection or why gastrointestinal infection is also common in pregnancy. Which are the home remedies for cough, cold? The first and foremost is steam inhalation. You have to take steam inhalation, should be taken at least 3 to 4 times a day, and for each time it should be 1 to 1.5 minutes. You should inhale from nose, then exhale from mouth, then again inhale from mouth, exhale from nose. It should take care to avoid burning of the inside of your nose or mouth. Another important thing is salt water gargles. Good hot water with good amount of salt, and do good 5, 10, 20 minutes of salt water gargles. Do it at least 3 or 4 times a day. Apart from that, be hydrated, stay hydrated, take plenty of good warm liquids, hot tea, hot coffee, hot milk, preferably turmeric milk, hot soups, hot lemon water. So always sip something hot throughout the day. Apart from it, if there is an excessive cough, you can take any form of Vicks, salts or Strepsils tablet, keep it in the mouth. They will prevent the irritation of cough. Does cough and cold affect the baby? In most of the cases, cough, cold, fever, sore throat does not affect the baby. Only if the cough, cold, fever is severe, persistent, then and only it may affect the baby, but in short term it does not affect the baby. What are the medicines for cough, cold, fever? It depends on what symptom the patient has. Usually most of the cases of cough, cold, fever are because of viral infections, and by the time the patient has symptoms, patient was already infected about 5 to 7 days back. So initial symptoms are body ache, malaise, weakness. For those symptoms, a plain paracetamol would do on an SOS basis. After 1 or 2 days, there is fever. Again, for the fever, we will give paracetamol 500 mg 3 times a day or 650 mg 3 times a day, depending upon the weight of the patient. After 1 or 2 days, the nose starts dripping and there is cough. In those cases, we give any cold medicine in form of phenylephrine or decongestant medicine or chlorpheniramine or pseudoephedrine based medicines. They should be given twice or thrice daily for 2 to 3 days maximum. And last, there appears the cough with expectoration or cough with vulgum. There is a yellowish colored sputum. That means that there is a secondary bacterial infection. In those cases, we prefer bacterial antibiotic called as azithromycin. Everybody knows we give normal azithromycin 500 mg once daily for 3 days or 5 days depending upon the severity. Please take it under guidance of your doctor only. And sometimes there is sore throat, there is cough with expectoration, yellowish sputum and fever, and most of the patients nowadays come after taking azithromycin to us over the counter. In those cases, we can give Augmentin 625 mg 3 times a day for 5 days. Is there any role of antiviral tablets, oseltamavir? I personally believe yes, definitely. If the patient comes to us early, Patient has only high grade fever and typical throat pain is there, not sore throat but typical throat pain. In those cases, I personally believe in giving oseltamavir 75 mg twice daily for 5 days. In most of the cases, within 3 days, almost all the symptoms are resolved. Again, I am stressing the point, please take it under the guidance of your doctor, a gynecologist or a physician, whatever you feel like. Cough syrup is a very favorite topic of most of the people. Whenever people come to me and they ask me, sir, why don't you prescribe cough syrup? There are two classes of cough syrup basically. One is a cough suppressant and one is a cough expectorant. In expectorants, there are bronchodilators, there are mucolytics, and there are mucolytics, expectorants, and bronchodilators. And one is a cough suppressant. In cough suppressant comes two groups of medicines. One is codeine and one is chlorpheniramine. Now, before you decide which type of cough syrups to be taken, let me tell you, cough is a protective reflex which has been given by the God to the human beings to prevent the aspiration of secretions or food in the respiratory tract. Because respiratory tract is not meant for any outside food or outside liquid. So, if there is any irritant either from nose or from the mouth in form of, or something goes inside the body will cough. And the purpose of that cough is to get that irritant out of your system. That is why cough should not be suppressed in ideal condition. And that is why I personally do not believe in giving cough suppressant syrup. I believe in giving cough expectoration. I want whatever the irritant or the foreign body is or whatever the mucus is, it should come out. The moment you suppress the cough, maybe for 1, 2, 3 days, you may be fine. The initial symptoms may get resolved. But if you suppress the cough, the mucus which is there, it will dry out. It will form an inspissated plug and secondary bacterial infection in that mucus may occur, and that may lead to the formation of consolidation or pneumonia later on. That is why I want that cough to be out rather than suppressed. And that is the plain thing why you should not take cough suppressant syrup. And I personally, occasionally for 1 or 2 episodes, it is fine, but it should not be taken for 2, 3, 4, 5 days. Which antibiotic I have discussed. Can one use Vicks? Vicks for local application, it is fine. Vicks Vapor Up, it contains camphor, menthol based. You can apply on nose, you can apply on your forehead, you can apply on your chest, it is fine, but it should not be ingested. But having said that, all those tablets like Vicks, Halls, Strepsils, Coughsils, they form a coating on the back of the oropharynx, and that coating prevents the irritation and as a result helps in calming the cough. So I personally tell my patients to be on some kind of Vicks, Halls, Strepsils or Coughsils tablet. They should always be taking. Apart from that, turmeric plus 1 spoon turmeric plus 1 spoon honey, it works wonder. Because in viral infection last 10-15 years, what I have found out is the acute episode for 4-5 days is taken care of, the cold is taken care of, fever is taken care of, but that irritating cough persists for about 15-20 days. And for that irritation, you don't need to be on any medicine, and that cough is basically more worse when you are lying down. So what I personally prefer and what I tell my patients is have 1 teaspoonful of honey plus 1 teaspoonful of turmeric and just gulp it down, keep it in your mouth, and that will form a coating on the back of the oropharynx. I personally am not in favor of taking the Vicks tablet or a Halls tablet or a Coughsils tablet while sleeping, because that may sometimes prove to be dangerous. Ideally, you should have completed your tablet before you go to sleep. Sometimes that tablet may go inside the nasopharynx or the larynx and may cause obstruction that may be harmful. So, in what cases of cough, cold and fever do you need to visit a doctor, and it can be serious if you are having chest pain along with cough, if you are having breathing difficulty along with cough, then you should preferably see AMD medicine, a physician. They will decide, they will evaluate if anything else needs to be done or you need a admission. Any kind of foods or fruits to be avoided in cough. Most of the people in my OPD tell me, sir, खट्टा खाने से cough हो गया, banana खाने से cough हो गया. You need to understand one thing, banana is a very good fruit as far as pregnancy is concerned. It is a great source of energy. It is an excellent source of fiber. It is a beautiful source of calcium and magnesium, which takes care of most of the nutrition in pregnancy. It prevents constipation, it provides nutrition, it helps in good healthy bones. But banana may sometimes cause the mucus to solidify, and that solidification can be prevented in some patients, can be prevented by steam inhalation, hot water gargles, taking plenty of fluids, good hydration. So banana should not be avoided according to me, and some patients think that eating anything sour, citrus fruits in form of lemon, orange or sweet lime, they cause cough. Again, there is no scientific logic to that. In fact, vitamin C is very good for providing the good mucosal immunity, and you should have good source of vitamin C in your diet. In last few years, many companies, many pharma companies and many agencies have advocated the routine use of annual flu vaccines for prevention of episodes of upper respiratory tract infection. There are various views on that. My sister is a microbiologist. She believes that this should be taken. There are different strains every year which cause the viral infection followed by the upper respiratory tract infection. You should have that vaccine ready, whether it is a H1N1, H1N2 or H2N1, whatever. Nowadays, the quadrivalent vaccines have come, which take care of most of the 4 strains which cause this viral infection. I am neither for it nor against it. But what I personally believe, that taking an annual flu vaccine would not prevent the episodes of viral infection, but they would prevent the severity of disease. Either they would prevent the high-grade fever, they would prevent the severe cough, they would prevent the progression of upper respiratory tract infection to a lower respiratory tract infection in form of pneumonia. So taking should not be an issue. Not many people may not be affording, but in West there is a routine trend of taking vaccines annually. That should not be an issue. If you are not taking, again that should not be an issue, as long as you are following the basic home remedies. And one last thing, for any female who is working during this season, especially from September to February, which is the flu season in India, you should wear the mask. You should follow regular hand hygiene measures like the ones we follow during COVID times. Proper hand hygiene and good use of mask would prevent the cough, cold, fever episodes in most of the cases. And that not only applies to the female. Basically, anybody who is going out may get the infection, because that incubation period is 4 to 5 days. In that 4 to 5 days, that person may infect the other people in the family. And therefore, anybody who is going out of the home during this season should wear mask and should follow routine hand hygiene measures, and that will go a long way in preventing cough, cold and fever, especially during pregnant females. Hope you like the video. Please share the video. Please subscribe to the channel. For further comments or further questions, you may DM to us or write into the comment box. Thank you. Bye bye.